I'm Dr. Tam Quinn. I'm a plastic and reconstructive surgeon with a special interest in head and neck reconstruction and also facial nerve reconstruction. So today I thought I'd talk about synkinesis and how we manage synkinesis. People are very familiar, I'm sure, with the use of Botox or botulinum toxin for cosmetic reasons, but there are also medical reasons why we use it as well. It's used for stiff muscles due to trauma or congenital reasons. It's used for debilitating sweatiness, but in my case I use it for managing synkinesis. So what is synkinesis? It's a condition that occurs after facial palsy. Uncommon, but certainly not rare conditions is something called Bell's palsy, where the facial nerve, which is a nerve that controls all the muscles to the face, gets squashed as it runs through the skull base. This often results in a fairly lengthy period of total facial paralysis. Now, a lot of patients do get recovery, many of them full recovery, but some patients end up with synkinesis. And what happens when you get that is that you get involuntary contraction of certain facial muscles that's associated with really innocuous things such as eating, talking, even blinking can cause some of your face to contract. And patients find it very distressing, but they also experience a lot of tightness in their facial muscles, which not only contributes to the discomfort, but can also exacerbate things like headaches and migraines and neck pain. So how we use botulinum toxin in facial palsy is to selectively weaken some of these muscles by injecting small doses of Botox into certain muscles just to turn off this pathway and to weaken some of these very stiff muscles, which can help patients to not only have reduced discomfort, but also improve their confidence in their day-to-day interactions with other people. What I do is, in consultation with the patient, I do a very thorough assessment, and in conjunction with a facial physiotherapist, we tailor a plan for the patient that involves not only selectively weakening muscles, but also exercises and facial exercise to help lengthen these muscles to improve their outcomes. Generally speaking, the effects last for as long as the botulinum toxin lasts, which is an average of about 3 to 4 months. I tend to see a patient about a month after I inject the botulinum toxin just to see the effects of it. It's not one answer fits everyone. We have to tailor it slightly to suit individuals. So at the 1 month consultation, we can adjust the dosage of the botulinum toxin. I ask patients if they've found certain areas more effective than other areas, and we can change the regime based on their symptoms. And I like to proceed to continue with this treatment regime for at least a couple of years until they've had a stable effect of the Botox. And then after that, we can discuss surgical procedures to make these lasting effects. So things like selective neurectomies, where you selectively cut the muscles, selectively cut the nerves which supply these muscles, or we can also transfer other nerves to strengthen certain other muscles as well. As with any use of Botox, there's always a few risks. I guess the main thing is not getting the result that you want, having a muscle that's paralysed a little bit too well. But I guess one of the good things about using botulinum toxin is that it's a fairly short-term effect. So I've certainly had patients who've had effects that they didn't particularly want, such as one who had some slurring of her speech afterwards, but she did have a significant improvement in her headaches. So she actually decided to do the same thing again the next time I did it. We just modified it ever so slightly so that we didn't get the slurred speech, and then we had an improvement in her symptoms. So it's a little bit of a trial and error, but generally speaking, botulinum toxin, unless you're pregnant or breastfeeding, is very, very safe.